Good evening, everyone. My name is Ellen Lafargue, and welcome to CHC's webinar, Everything You Always Wanted to Know About Hearing Loss But Were Afraid to Ask. This event, like all of CHC's event, is accessible to people with hearing loss, so I would like to go over some of the accessibility issues with you tonight. We have captioning available, and there should be a slide on your screen that talks to you about what the captioning options are. There we go. So the captioning will depend on what type of device you're using. If you're using a computer or laptop, please look for the CC icon that's on the bottom of your screen and press on the button where it says Show Subtitle if you want to see the captions. If you do not want to see the captions, then click on the button that says Hide Subtitles. If you would like to be able to change the settings, you can do that in the subtitle settings screen. If you are using a tablet or a smartphone, you tap on the screen and a toolbar will appear at either the top or the bottom of the screen. Tap the word More and select Settings or Meeting Settings and toggle the button to put on the closed captions on or off, and then tap Done. If you are interested in the stream text link, you can see it on the screen. The URL is there. It's also going to be in the chat. If you're having any issues understanding how to get to the captioning, or if your device is not working properly, feel free to call the number on the screen or to email Brenda Irizarry at the email address that's on the screen. And this information is also in the chat box on the side of the screen. So during the course of the evening, we hope that you will ask us questions. Many of you have submitted some wonderful questions that when you registered for the event, that we will try to get to as many of the questions as possible tonight. And if you have a question that you did not enter in ahead of time, just use the Q&A button on the bottom of your screen and type it in, and we will get to as many of those questions as possible. I would like to introduce myself again. My name is Ellen Lafargue. I'm the director of the Shelley and Stephen Einhorn Audiology Center at the Center for Hearing and Communication. I am very honored to be the director of a very talented audiology staff and hearing aid dispenser, and I would like to introduce them all to you. So we're going to bring them up on screen now. And I would like each of them to introduce themselves to you one at a time. Michelle, if you would introduce yourself, please.
I'm Michelle DeStefano. I'm a senior audiologist at CHC. I've been an audiologist for 22 years, 4 of which have been at the center, and I see children and adults.
And Terrence?
Hi, I am Terrence Williams, and I'm the Assistant Director of the Barrelson Hearing and Technology Center at the Center for Hearing and Communication. I've been working at the center for about 30 years, and I manage the department that takes care of all the ordering and repairing and impression taking and assistive listening devices.
Thank you. And Jane?
Hi, I'm Jane Oriemo, and I'm the clinical supervisor. I've been at CHC for 10 years. I work with both children and adults, and my areas of specialization are hearing aids, auditory processing, and tinnitus.
And Susan?
Hello, I'm Susan Adams. I'm a senior audiologist and have been at CHC for almost 30 years, and I manage the Tinnitus and Hyperacusis Center.
Thank you. And Shelby?
Hi, everyone. My name is Shelby Pladia, and I'm the current 4th year audiology resident, and I've been here since June.
Thank you. And we will be speaking with all of you during the course of tonight. And I think the best thing to do is to get started on these questions because we have quite a few of them. So Michelle and Susan, if you would stay where you are, and we'll get started. So Susan, I think this first question is for you. Someone wrote in, a lot of times I have to ask my kids to repeat themselves, but my audiologist says I can hear things that aren't even a whisper. How is that possible?
It could be that your audiologist or an ENT who might look at your audiogram was making a generalization just by eyeballing the test results on what we call the audiogram. But the audiogram doesn't tell us everything. It gives us numbers, but it doesn't tell us how you function. So you could actually hear less than a whisper for a sound like an E, but hear more or have a hearing loss at a sound for a sound like an S or an F and such. So if one of your kids was to say the word else, it might sound like the word elf, E-L-F. So, and this makes some words sound like other words, which is what makes you say what when your kids ask you or speak with you.
Right, yeah, and it's really important, I think, for people to realize that if you say what, it doesn't mean you weren't listening or paying attention. It's just, sometimes you mishear things. That's part of the deal, right? Another question, Susan, that came in was someone says, I wear hearing aids, but I'm still having problems hearing. How do I know if the problem is my ears or my hearing aids?
It's important to have verification of how well you're hearing with your hearing aids. So in CHC, what we do is we test you at a normal conversational level. We'll ask you questions. We'll have you repeat words and see how well you hear the words at a normal level and also at a soft whisper level. In addition, we test you also in noise. So these three measures can all let us know how well you're hearing with your hearing aids. There's also a test called a real ear measurement that lets us know it's an objective test. It doesn't involve your doing anything, telling us anything, but it lets us know how much sound is actually getting to your eardrum.
Michelle, can you tell us a little bit more about that real ear test that she mentioned?
Certainly. What we can do is use an actual machine where we program your hearing loss into that machine, and then we program the hearing aids. The machine itself actually lets us know what targets and what areas you should be hearing better with your hearing aid, and if we're giving you enough sound and enough amplification. We can do that on your ear, where we test to make sure the hearing aid's giving you what you need based on your hearing loss, or we can actually do it in the machine itself. And that'll at least let us know that the hearing aids are set appropriately for your hearing loss.
Thank you. Another question that we got was someone said, I can hear fine except in noisy restaurants or large groups. Can hearing aids help me? Michelle?
So hearing aids will be able to help when you're having hearing difficulty in background noise or a large group setting. It is also dependent on how you are hearing and how you're able to get clarity of words. Hearing aids will give you volume and will replace some of the pitches you're missing, but you have to remember that clarity is also based on your hearing loss and how well you can recognize words when tested. So hearing aids will help in background noise because it's going to give you some of that information that you're missing back.
Thank you. Thank you. I think we'd like to hear from Shelby now. I'll talk to you, Michelle, I'll talk to you and Susan a little bit later. Okay. Shelby, how you doing tonight?
Good, how are you?
Good, thanks. So the question I have that came in was, how often should I have my hearing checked, and what does earwax have to do with my hearing? It's a two-parter.
Yeah, so for the first part, you really want to get your hearing checked at least once a year, annually. That way your audiologist can monitor your hearing over time, see if it remains stable, if it remains the same, or if there's a decline in hearing. Now, if you experience a sudden change or a sudden decrease in hearing, you would want to follow up with your audiologist or an ENT right away. It's imperative that you do that because sometimes for people who experience a sudden hearing loss, if they receive treatment, in a quick enough time period, there's a chance that that can be reversed. So to answer your second part, what role does earwax play for someone with a hearing loss? Earwax does serve as it does have a protective function. However, it can be very difficult for those with hearing loss and especially for those with hearing aids. So if you're someone who has a lot of buildup of wax or even just a little bit of wax, it can block or reduce the sound that's coming in. If you're someone who uses hearing aids and it gets in the receiver of the hearing aid, it can actually stop the hearing aid from working altogether. So, it may require that you go to your doctor more frequently to have your ears cleaned. And it also may require you to try to keep up with cleaning your hearing aids more often.
Right. One of the good parts about wax problems is that it's very fixable. You have the wax taken out, the problem goes away. So while it can be a little bit of a pain in the neck, it's really not so terrible. We can deal with that. It brings up another question that came up, which is that there are studies that show that not using a hearing aid when a person has a hearing loss results in the hearing getting worse. Is there any truth to that?
So, while hearing may not get worse from not using hearing aids, there are studies that show your word recognition ability, your ability to repeat back words can decline over time if you don't treat the hearing loss. And it makes sense because your brain is lacking the consistent auditory stimulation that it wants. So it's kind of like the phrase, if you have ever heard, if you don't use it, you lose it. So without consistent sounds going up to your brain, it becomes more difficult to repeat back words and more difficult when you go without certain sounds for so long.
Okay, great. Thank you. I think we'll talk to you later. I have a couple of questions that I wanted Jane to be able to answer for us. And Jane, I have a question that says, what is the difference between a hearing problem and an auditory processing disorder?
A hearing problem involves the outer, middle, or inner parts of the ear and causes the individual to have difficulty detecting sound. Auditory processing problems involve the pathways from the ear throughout the brain. And this has to do with how efficiently we process sound. So tasks like the ability to hear well in challenging environments, to distinguish sounds that may sound similar but are different, and those kinds of things. A person can have normal hearing and have an auditory processing problem. A person can have both an auditory processing problem and a hearing loss, and a person with a hearing loss can have no difficulty with auditory processing.
Is there anything that we do about auditory processing?
Well, as Shelby was just saying, stimulation is good. So fortunately, especially for young children, the auditory pathways are plastic and can change. The good news is that studies have shown even the adult auditory pathway remains somewhat plastic, meaning that if we stimulate with auditory information, we can improve the efficiency of the information flow.
Thank you. So interesting, the whole topic. The next question that came up is one that I must hear 6 times a week, and it says, I have been told I have a 50% hearing loss. What does that really mean?
Well, today we don't typically use percentages to describe hearing loss. We use the terms normal hearing, mild hearing loss, moderate hearing loss, severe hearing loss, profound hearing loss. A moderate hearing loss is about 50 decibels. So that might be what got kind of mixed in translation. And with a moderate hearing loss, the individual would miss most of conversational level speech, would still be able to hear loud speech.
Thanks so much. That's so interesting. The next couple of questions, I think I'm going to take myself. We get this question all the time, and that is, I can save money by going to a big box store to get my hearing aids. Should I do that? You know, no one is going to look in your checkbook and say, you know, this is worth spending money on, or it's not worth spending money on. And of course, we want as many people as possible to get hearing aids that they may need. There are issues of the quality of the care that you get, and you want to be sure that the person you're seeing has experience with hearing aids, that they have experience with people and not just hearing aids, and that you are getting as good an experience with the hearing aids as possible. The other limitations of going to a big box store is that many times the technology that you purchase at one of those stores can't be adjusted anywhere else. So while you may feel like, well, I'll get the bargain and then I'll find somebody else to take care of it for me, that's not always a possibility. So you do want to be careful and ask a lot of questions so that you get what you think you're going to get. Another question that we get a lot is, are hearing aids covered by insurances? And so there are hearing aids that are covered by Medicaid. For most adults, Medicaid will pay for one hearing aid if they have more than a mild hearing loss. For those people who have Medicare, hearing aids are not covered. There are certain supplementary insurances that have discount programs for hearing aids, but Medicare itself does not cover hearing aids. And some private insurances do have a hearing aid benefit. Many, if not all of the benefits, cover hearing aids partially, but you do have some coverage. So those are some questions that we hear quite a bit. Michelle, if you could join me again, I do have a question that came up for you. And somebody writes in, it says, unlike buying an upgrade on a car, for example, leather seats, what is the difference in buying a more expensive hearing aid or a cheaper hearing aid?
So often you should be able to talk with your audiologist about what would work best for your communication needs. Some people will need more advanced hearing aids that are more automatic, that offer more programs and offer more flexibility. And often the higher end technology will have a higher cost. However, you have to consider what works for your financial needs, for your dexterity, for your communication needs in your daily living as well, and how adaptable they will be for you in deciding which level of technology to go with. And that should be done alongside your audiologist.
Thank you. Another question that just came up is, when should a person consider getting a cochlear implant as an adult? And just very briefly, if you could describe in one sentence or less what a cochlear implant is, good luck, and when somebody might consider that.
So briefly, a cochlear implant is a surgical implantation of electrodes that go into the inner ear. There is a magnetic piece that stays under the skull, under the skin in the skull, and you wear an external microphone or processor that picks up sound and transmits it to the electrodes that will then stimulate the inner, cochlear nerve so that you can hear better. It is not a magical fix. There is some adapting to the sound with it, but it is an option for people who hearing aids will no longer benefit. So if you have a hearing loss that is severe enough that a hearing aid will not benefit, or if you have word recognition that is severe enough that your hearing aids will not benefit. There are some people whose hearing loss will get more detection from sound from a hearing aid, but they will not be able to discriminate words well. And those people would benefit from a cochlear implant. The best thing to do if you're not sure if you would benefit is to go for a cochlear implant evaluation. They'll test you with your hearing aids. They'll test you with the optimal hearing aids, stronger hearing aids if necessary. with words, with sentences, and then discuss your options.
Thank you. Now I'd like to bring Shelby back for a minute. Shelby, I have a couple of questions here that I think are interesting. It says, the person wrote in, describe the daily life of a hearing aid wearer. In other words, what I think he's trying to ask here is, when do I wear my hearing aid? When don't I wear my hearing aid?
So the daily life of a hearing aid user can vary person to person. For some people, they may be in more quiet environments, may wake up, have their morning coffee, listen to the news. Some other people may go to work right away, talk on the phone. Ideally, you want to wear your hearing aids from the time you wake up until the time you go to sleep, regardless of what you do day to day. Now, there are some exceptions to that rule. You don't want to use your hearing aids when you're showering. If you were going to go swimming, you don't want to get the hearing aids wet. If you're someone who uses hairspray or blow dries their hair, you also want to be mindful of taking off the hearing aids because that can actually damage the aids. And you also don't want to sleep with the hearing aids on. So, ideally you want to wear the hearing aids all day long so you're getting consistent auditory stimulation, what's been brought up before. And that's what we highly recommend, is wearing them as much as possible.
Thank you. Thank you. We'll talk a little more later, okay? I'd like the next, I have a couple of questions. I'd like to bring Terrence up. We have a couple of technical questions about hearing aids. I'm glad to see you're still here, Terrence. The question that I have, first of all, is I wear hearing aids and my wife says the TV is still too loud. What else can I do?
Well, there are all sorts of devices, assistive listening devices that can help with television audio. As a matter of fact, very many of the hearing aid manufacturers make proprietary devices that we can use to attach to your TV, to your hearing aid. So the basic idea is the closer we can get the sound to you, to your eardrum, the more likely you are to understand what's being said. So if we can stream the television audio directly to your hearing aids or to another device like a headset or headphones, you'd be able to understand much better. I personally like the idea of the devices that the hearing aid manufacturers make. And there are some other devices too that can do this as well. But you have your own sort of independent volume control as opposed to the volume on the TV. So you could raise and lower the volume for yourself while everybody else in the room gets to listen to the TV at a more tolerable level.
So with so many options, how would a person know, what they should do? Like what's the best thing for them to do?
It really depends on the severity of your hearing loss. But at the Center for Hearing Communication, we do actually have a space where we can test out a couple of different devices so that you can get an idea of what works for you. Very often, I also recommend when you make your purchase for a device that you consult your audiologist, especially if you have a hearing loss, to see what device might work best for you. And yeah, I think that's about right.
And what if we have some people here, and this is my question to you, wasn't in the chat here, but what if some of the people here are not wearing hearing aids, but they're having trouble understanding television? Is there anything they can do?
Yes, there are devices that are made specifically to bring sound from the TV closer to the individual. You can get external speakers. You can get infrared headsets, sort of like the headsets that you can get in the theater if you need assistance in the theater listening. There are, like I mentioned before, there are manufacturers, hearing aid manufacturers that make devices that can work without hearing aids as well, so that sound can get closer to your ear. And they range the gambit from $50 to several $1,000s. It all really just depends on how into television you are and how sound works for you, and we can help you figure out which one would work best.
And then, of course, there's always captioning that's available on not every show, but on most shows now.
Of course,
Right.
captioning is always a great thing.
Right. Somebody asked here, what is a wax guard and do I really need to change it? And if I do, can I clean, if I have to change them, can I just clean them instead?
Oh boy. Okay. So very many hearing aid manufacturers now, we've had lots and lots of time to understand how pervasive wax can be and how it affects hearing aids. And you're listening and you're hearing with them on. I think someone mentioned it earlier tonight too. But yes, hearing aid manufacturers make these things called wax guards, and it's meant to prevent the wax from getting inside the hearing aid and clogging up the receiver or the speaker, which is where the sound comes out. And so those wax guards do need to be changed on a regular basis. I usually recommend when you change your batteries to change your wax guards just to make sure there isn't a buildup. But some people make less wax than others, so some people can go a little bit further. As far as cleaning the wax guards, I would not recommend that. They're meant to be disposable, and cleaning them can damage them, which could then result in the wax getting into your receiver and mucking up the work, so to speak.
So if the wax gets into the hearing aids, then you can really cause damage to the hearing aids that might need a repair, whereas just throwing away the wax guard just takes sort of care of it, right?
Indeed, indeed. It's always best just to replace it.
Thank you. Thank you as always. The next question I'm going to take for myself. Someone asked, I've heard about this thing called an over-the-counter hearing aid. Are they available? So there's been a well-accepted issue in this country that there are many, many more people with hearing loss than there are people wearing hearing aids. And the assumption is that a lot of it has to do with the affordability of hearing aids. And so several years ago, there was a bill that came before Congress to create a new category of hearing devices that were called over-the-counter hearing aids or self-fit hearing aids. And these are intended for people with mild and moderate hearing loss. And the bill was signed into law by former president, and it went to the FDA to create rules surrounding these devices so that they would be, legitimate devices and not be problematic, create a new set of problems for people. And those rules were supposed to come out last August so that they could begin to be sold. And, the FDA was a little busy with things going on in the world other than hearing aids. And so August came and went and the rules never came out. So we don't really have a good set of rules on this yet. And we are patiently or not so patiently, depending on who you are, waiting for that. We do believe that when they come out, they will have a real place for a lot of people who have hearing loss. And CHC looks forward to being able to figure out what we can do to help people with those. And we just don't have a really good answer yet for those. The next couple of questions that came in were about tinnitus, and I'd like to bring up both Susan and Jane. We are very fortunate to have two skilled practitioners in TRT, or tinnitus retraining therapy. And the first question, Susan, I'd like to ask you. Someone says, I read on your website that there's something called hyperacusis. Can you tell me what that is, and is it the same thing as tinnitus?
Sure. Hyperacusis is a sensitivity to everyday sounds that are normally tolerated by others. It's when everyday sounds seem much louder than they did or they should. And people report it's a physical discomfort to sounds around them. Whereas tinnitus is a ringing, buzzing, humming, hissing, or other kind of sound that is heard in the ears or the head, also not heard by others. Neither are a disease, and both can be treated. And with hyperacusis, it's as if your ears have forgotten what's normally loud. And they need to be, your auditory system needs to be reminded of what is normally loud. So we treat hyperacusis using a method called tinnitus retraining therapy, even though it's called tinnitus retraining therapy. Hyperacusis is under the jurisdiction of that protocol. And it's a desensitization to sound. It's an education regarding the mechanisms as far as we understand them. And it's also using sound through ear level devices and sound through sound from environmental sound to gradually desensitize the auditory system. And it actually takes sound to retrain the mechanism to retrain the brain's skewed interpretation of what it thinks is too loud.
That's so interesting. So this is something that, is it like a week or 2 weeks, or does it take a while? How does this work?
Hyperacusis can just go away. And in the program, it can be very quick. It can also take many months, depending on the person.
Thank you. Jane, I have another question about, someone wants to know, is there a cure for tinnitus? And which Susan alluded to a little bit. And also, do hearing aids help at all with tinnitus?
Well, there's no cure for tinnitus per se. There are ways to change an individual's reaction to the tinnitus, and in turn, with time, to potentially change the perception of the tinnitus, meaning that it can and will hopefully decrease. For individuals with hearing loss, many of them are effectively treated with hearing aids. So the thinking is the hearing loss, again, we've talked about this before tonight, results in a lack of stimulation in certain parts of the auditory pathway. And our brains want to make up for that sound. And somewhere along the line, they are, creating this sound, which no one else can hear but the individual. So use of the hearing aids can solve that problem. The tinnitus may still be present when the individual removes the hearing aids. So for many people, hearing aids are effective.
So what you're saying is you put the hearing aid on and you're not as aware of the tinnitus, and then you take the hearing aid off, it's still there, but it's may not bother you as much. Is that what you're saying?
If only it were that simple. But for most people who have hearing loss and tinnitus, they are alleviated. They feel relief when they're wearing their hearing aids. And this may also be because the difference between their tinnitus sound and the environmental sounds is lessened with the hearing aids. So as they acclimatize, even when they remove their hearing aids, they can learn to use other environmental sounds to do the same thing, which is to decrease the contrast between their own sounds and the environmental sounds and be less bothered by tinnitus.
Can Susan, can you give me give us all a picture of what tinnitus retraining therapy involves? Does a person fill out a paper? Do they have a conversation? What's involved?
What's involved usually is a free consultation on the phone, a 15-minute consultation to decide what route to take. The first visit after that would be a virtual 1-hour visit where we go into depth about the reaction that the individual has regarding the tinnitus. Because it's really, there are two things when you have tinnitus. It's the sound, it's an auditory event, and it's there's a non-auditory event, which is your reaction. So tinnitus retraining therapy it's an education, discussing your reaction. And the first goal of TRT is the reduction of the reaction. So if there's no reaction to the sound, then it has a chance to get lower. And the program itself can take 6 months or less, again, depending on the person.
So it's sort of like a knowledge is power kind of a thing.
Exactly. Yeah, it's to diffuse the concerns regarding the tinnitus.
I'd like to bring everybody back so that we have the whole crew here. I have just a couple of more questions that we wanted to look at. Somebody writes in that mask wearing makes it harder to communicate now in 2021. What can I do about that? Who wants, Shelby, you want to take a stab at that one?
Yeah, so, masks have caused a lot of people difficulty communicating with one another. Obviously you want to respect the safety guidelines because we would always recommend to be as close as possible to someone when you're speaking to them. However, if that is not possible and you are wearing masks, there are different alternatives you can use, such as pen and paper. There are also speech-to-text apps that you can use, like Otter, Ava, or Google Live Transcribe, that you can actually hold up on your phone, and someone can speak into the phone and it will actually type what is being said right in that moment. If you're someone who uses hearing aids, you can consult with your audiologist about a mask wearing program where they can put more emphasis on the pitch range that is lost due to wearing masks.
We had one person who just wrote in and said she has a medical procedure coming up in a hospital, and she's concerned about her being able to communicate with her doctors. Who, I know at CHC, we try to wear clear masks. In other words, does anybody happen to have one nearby, a clear mask? So that because a lot of people with hearing loss do rely on, I'm stretching here, there we go, rely on speech reading or lip reading. And so with a clear mask like Terrence has on right now, because of the lighting, we can't really see, but if we were in person, we would be able to see his mouth behind that clear panel that's in the front. Thank you, Terrence. Always prepared. So appreciate that. Another person wrote in a question.
Can I
Yes,
add one
please.
thing to that? Also, too, depending on your level of hearing aid technology, you might be able to get an external microphone that you can use to point at the person who's speaking to you. That would pretty much effectively get that sound closer to your ears and make it easier for you to hear. So you should talk to your audiologist about that as well.
Can you just define what an external microphone or what it might look like?
So sure. Hearing aids, of course, have a microphone that listens to sounds and a speaker that emits the sound so that you can hear it. You can get microphones that are outside of the hearing aid that you can attach to the hearing aids, generally through what we call near field. I'm getting a little bit in the weeds here, but it would connect to your hearing aids wirelessly and effectively act as a third or fourth microphone for you when you're talking to people in the street. It also helps with noise and background noise and those kinds of good things.
And one point that I should have brought up earlier that I didn't was that if you have questions in response to what we're saying here tonight, that we haven't explained quite to your satisfaction, there will be an opportunity at the end. We will have an Ask the Expert email that you can write to, and we will absolutely answer as many of those questions as we possibly can. So please feel free to take advantage of that, and that will be up on a slide at the very end. So don't feel desperate that we haven't addressed your issue. I do have another question that this came up just this afternoon with someone in my family who wears a hearing aid. How do I stop from losing my hearing aid when I take my mask off? Literally, I spent 15 minutes this afternoon. So who wants to take that one? Michelle, you want to give that one a shot?
Sure. we all know that the masks typically go behind your ear. And so if you have a hearing aid that goes behind your ear, you're going to take the loop off, and quite often you knock the hearing aid out. There's some way to get around it is to use a mask that doesn't necessarily go behind your ear. They do make masks now that will loop behind the top of your head and the bottom of your head so that it's not sitting behind your ear. They also make little clips that you can put the two loops when they do go behind your ear in the center of your head, so it's not leaning on the hearing aid when you go to remove it. And it's also, you want to be aware that when you take the mask off, you have to pull the loop out and around your hearing aid. It's been happening quite often. People are losing hearing aids because of mask use. And sometimes just modifying the mask you have will help that.
Okay, thank you. Anybody else have any other suggestions about how not to lose your hearing aids?
Yeah,
Anyone?
just to go off of what Michelle said, if you are wearing a mask, I actually have one with the loop that goes around your ear. As Michelle said, you can push it back away from your ear and then away from your head. What some clients have found effective while doing this is actually holding the hearing aid with your opposite hand. And if you feel that the hearing aids, no matter what you do, what techniques or strategies you use, the hearing aids just pop off, then it may be worth it to, carry your case with you, put your hearing aids in your case for, 1 to 2 minutes while you take off your mask, and then put the hearing aids back on. And you always want to make sure that you're in a well-lit room. That way, if the hearing aids do fall off, you're able to easily find them.
Okay. I think, let's see, let me see if there's any other questions right now. Here's an interesting question. It says, are there any ways to have my hearing aids adjusted without coming into the audiologist office? Jane, you want to address that for us?
Sure. Most manufacturers now enable us to do certain hearing aid programming remotely. So depending on what your problem is, it may be as simple as using your phone or your laptop or a tablet and communicating with the audiologist to be able to program your hearing aids remotely. So you may have to accept an invitation from them or sign up first. But once that is established, then the audiologist can change the sound of your hearing aids, change the programming, and make other kinds of adjustments without you having to come into the office.
Thank you. Let me just take a quick look here, see if there's any other questions that we haven't addressed. I think, looks like we have gotten to just about everything that we have right now. So I do want to thank everybody for your attendance tonight. I want to thank my staff, first of all, for your participation tonight and for your wonderful answers and for the services that you provide all of the time. They are very much appreciated certainly by me and by your clients. We also like to thank all of the participants tonight. We are going to bring up a slide that will show you how to contact us. First of all, we do have some other webinars coming up over the next month or so. You may or may not realize that May is Better Hearing and Speech Month. And so we do our best to celebrate that month with as many programs as we can. And you are welcome to sign into any of these, and you can learn more at the URL that's on your slide. It's on our website, and you will be getting an email from us as a follow-up. If you signed up for this webinar, you'll be getting an email from us in the next day or two, and it will have information about how to access these other webinars as well. So again, we thank you for your attention, and thank you for participating, and have a good evening. Good night.